Hi, everyone. This is Tracy Russo. I'm the president of HTA Insurance Services, and I'm really excited to be doing this presentation with you. We're going to go over a lot of information about Medicare, but don't worry if you miss some of it. We are here for you as your support system to help you with everything as we go. Okay, so let's get started. This presentation is called Your Roadmap to Medicare, and as I'd mentioned, we're going to go over a whole overview of Medicare, the parts and pieces, what it costs, what it covers, and the proper timing to enroll. But before we get started with all of the meat of the presentation, I'd like to just give you a quick overview of who HTA is and how we can help you with your retirement healthcare decisions. As you probably know by now, Medicare can be very overwhelming. And we are here to simplify that for you, because what happens is as you approach your 65th birthday and forever thereafter, you will receive lots and lots of Medicare mail. You will receive solicitation calls and lots of advertising. And the messages are all just a little bit different, and it can become very overwhelming and confusing. So we help find out a little bit more about your situation, what your objectives are, what your timeline is and your medical needs, and we can simplify that for you by telling you exactly what pieces of information are relevant to you. So we will simplify and personalize your Medicare experience to make it nice and easy for you to get set up. Now, we provide all of our services for free. We don't charge anything for any of our consultations or assistance, and you have unlimited support from us. You can call us at any time and ask questions. We've been specializing in Medicare for over 20 years, and we have access to over 35 and now probably over 40 or 45 different insurance companies for the related Medicare products. So you can always choose what is most important to you and what is most appropriate for your situation. In addition, we provide services nationwide. So if you have friends or family in other states, we can help them as well. We are licensed in something like 48 states right now. Now, what makes us different from a lot of the solicitations you're receiving is when you call our office, you're not going to be talking to a commissioned salesperson. Everybody in our office is a salaried employee. So yes, they're licensed, yes, they're certified, but they are not incentivized or bonused or commissioned for selling you a product. So they are here to truly hear what you have to say, help you make the right decisions, whatever best for you, and it has no impact on their overall income. So you'll never feel any sales pressure from our team. So as I mentioned, this is a complimentary service. It's available to you, your friends, your family members. Anybody can call in nationwide to get our assistance. So you may be thinking, well, this sounds too good to be true. How do they offer all of this free support without charging anything? How does HTA make their money? And just to be completely transparent, our only ask, our only request is that if you felt that we were helpful, if you liked working with my team and you thought we were friendly and added value to your experience, when the time comes for you to enroll in Medicare, please keep us in mind and please allow us to help you with that. Because by completing your enrollment applications with the various Medicare supplements, prescription drug plans, Medicare Advantage plans, maybe even dental vision, the insurance companies will pay HTA an enrollment fee to do that. And that's ultimately how HTA can stay in business and continue to provide the free education and support to you. The good news for you is you don't pay any more for the insurance by enrolling through us rather than going directly to the insurance company. So you get the extra level of support from us, and you are not paying anything additional if you were to do it on your own. So I'm going to go ahead and get started right now, just starting from the very beginning. What is Original Medicare? Original Medicare is the health insurance that becomes available to you or your friends or family when they turn age 65. So this is a straight age 65 qualification. It has nothing to do with your quote unquote normal retirement age. So you may be thinking, well, my normal retirement age is 66 or 66 and 2 months. I don't need to think about Medicare until I'm at my normal retirement age, but that's not true. Normal retirement age pertains to when you can collect your full Social Security income benefits. It does not have anything to do with Medicare benefits. So at age 65, you have a decision to make. Do I enroll in Medicare like all of the literature I'm receiving says I have to do? Or do I have a valid reason to defer my Medicare until later? In addition, you might be eligible for Medicare if you're under 65 and collecting Social Security disability income, or if you have any kidney issues like end-stage renal disease, kidney failure, kidney dialysis, or kidney transplant. Now, when you set up your Medicare insurance, there are 4 parts and pieces to make up comprehensive health insurance. So you're going to need a couple different things, and this is why many people feel that it's confusing to be in Medicare. So you're going to need the federal government program, which is Medicare A and B. You're also going to need some type of secondary insurance from private insurance companies. So that falls into the C and the D categories. Medicare Part C is Medicare Advantage, or you'll have the option to choose Medicare Supplement, which is otherwise known as Medigap insurance. And then the D program is the prescription drug plan. So think of Part D, D for drugs. So what I'm going to do is I'm going to walk through the parts and pieces of Medicare and each one of them individually and talk about what they cost and what they cover. So talking about the base Medicare program through the federal government, there's Medicare Part A, which is available to most people at no cost. So as long as either you or your spouse has paid Medicare taxes for a minimum of 10 years throughout your lifetime, you are able to collect Medicare Part A at no additional cost. That's what your taxes pay for. Part A is your inpatient hospital coverage. So I always say think of A for admission into the hospital. If you're admitted in the hospital, it's going to fall under Medicare Part A. And it does cover some other things as well, but primarily it's for inpatient hospital stays. Now, Medicare Part B is your outpatient coverage. So it's called Part B medical, but I would like you to remember A is inpatient and B is outpatient. So everything that you're not admitted to the hospital for example, doctors and specialists, labs, x-rays, MRIs, surgeries, chemotherapy, even things that you go to the hospital for but you're not admitted for example, emergency room treatment, or if you're in the hospital being observed for a couple days, hospital observation, that is all considered outpatient coverage and it falls under Medicare Part B. Now, Medicare Part B does have a cost, and the cost is going to be dependent on your income. Now, the base Medicare Part B premium for 2021 is $148.50 per month. So as you can see by looking at this graph, if your income, if you file your tax return as an individual or a single and your income is up to $88,000 per year, or if you file your tax return as a joint or a household and your income is up to $176,000 a year, you will pay the base Medicare premium of $148.50 per month, and that's per month and that's per person. That's a per person premium. If you're collecting Social Security income, this is going to come directly out of your Social Security income. If not, the Social Security Administration will bill you for that amount of money. But as you see, if your income is higher, and you see the different income brackets here, you will pay a higher Medicare premium. So a couple things to note here is, number one, this premium is the same for each spouse. If you file your tax return as a joint household, it doesn't matter who the breadwinner is. Both of you will pay the same premium based on your household income. In addition, this is not just W-2 income they're looking at. What they're actually looking at is your modified adjusted gross income. So this unfortunately cannot be found as a reference anywhere on your tax return, but I always tell people, look at the bottom of the first page of your 1040. That's going to indicate your taxable income or your adjusted income. This is a very close estimate as to what they will be looking at when determining your Medicare premium. So that's a real good indication. But possibly most importantly, it's good to know that they're looking at your income from actually 2 years ago. So when you go to apply for Medicare, which you're doing through the Social Security Administration, they don't have access to your current tax return. You may not have even filed it yet. So what they do is they look at the tax return from 2 years ago because that's the one that they know that they'll have on file. And they're going to base your premium on that. And you may be thinking, well, that's no good because 2 years ago I was actively employed and earning a much higher salary than I will be now that I'm retiring or cutting back on my work schedule. So why am I having to pay more because of what I earned in my past? And the answer is it's not always going to be that way. So there's a couple options here. If you're at a higher income and you anticipate your income to be going down in retirement when you enroll in Medicare, number one, you can just wait it out, because every year the Social Security Administration reevaluates your income. So at the end of 2021, December, they're going to look at your 2020 tax return when assigning your premium for January 2022. So it's always 2 years back that they're looking at, but each year they update it. So the Social Security Administration won't find out that your income went down in 2021 until they do the review for your 2023 premium. So your premium will go down at that point, but guess what? They're not going to pay you back for the overpayments and premium that you made for the past 2 years while you were earning that lower income. So what we normally recommend, and as we talk to you, we find out about your income and how that's going to change. And what we normally recommend is that you file an appeal. And we can send you a copy of the appeal form. It's called a life event form. And by the way, any forms that I mentioned throughout this presentation, if you'd like to have a copy of them, simply type it into the chat box or send us an email at medicare@htafinancial.com. And we will happily send you a copy of those forms so you can see what they look like. If you do legitimately anticipate your income's going down, why pay more for Medicare if you don't have to? So we typically recommend you file the form. It takes maybe 5 or 8 minutes to fill out. It just asks a couple of questions about your income, and then you send it in, they'll review it and assign you your new Medicare premium. Okay, so Medicare A and B through the federal government is great baseline coverage. It does not cover everything, and there are certain things that are excluded from Medicare. For example, dental care, vision, except for medical conditions like cataracts, glaucoma, diabetic eye checkups. Hearing aids are not covered by Medicare. And things like long-term care. I don't know if you've ever heard of long-term care. What I'm talking about is like home health aides, assisted living, nursing homes. They're typically not covered by Medicare if they're for everyday needs. So if you need help getting around and getting dressed and getting a shower, Medicare does not pay for those type things. What it will pay for is rehab services. So physical, occupational, or speech therapy, certain restrictions apply, but they do not pay for everyday help with personal needs. So just so you know, there are separate policies available to cover some of these things. There's long-term care insurance, there's dental, vision, hearing policies, and some of the Medicare Advantage plans, and you'll see them advertised on TV, may also include extra benefits for dental, vision, hearing aids, and things along those lines as well. So definitely ask about that if that's a concern for you. Now, where we find the biggest confusion lies for most of our clients is in the when. When do I need to enroll in Medicare? Because as you approach age 65, you will get bombarded with mail. And it's going to say things like deadlines, penalties, must enroll. And you may be thinking, well, I'm still working, or my spouse is still working, and I have group coverage and I'm pretty happy with it. Why do I even need to think about this now? But then as the mail continues to flood in and you see big capital letters that say penalties, you start to get a little bit more nervous and you think, maybe there's something here. I should probably look into it. So because of that, we always recommend that you give us a call around age 64 and a half, maybe right before your 65th birthday, and just check in, and we'll talk to you about your situation. Do you anticipate continuing to work? Are you covered under your group plan? Do you have a health savings account? These are all very important things to find out when determining whether or not you do or do not need to take any action with Medicare for your 65th birthday. So give us a call. It'll put your mind at ease, and we'll be able to tell you exactly what you do and do not need to do. And we'll put that all in writing to you as well. So what I have on the screen here is just an example of some of the information that we provide you with. So after every phone call, you will receive an email from us. And the email will contain specific details about what we're telling you you can or cannot do. For example, this is a copy of what we call our roadmap webpage, roadmap leading into Medicare. And we'll address things like, will you receive a penalty if you don't enroll? What is your deadline to get enrolled? And do you need to have Medicare to have full coverage? So all of those things will be answered for you in a short form manner, easy to understand. And then if you click on this little plus sign right here, a big box is going to open up and it's going to indicate the specific Medicare rules and guidelines as to why we're providing you with the answer that we are. You'll be able to read it right from the Medicare and or the Social Security webpage with those exact rules. So that way you know you're making a decision based on sound advice. Now this little icon over here that looks like a report is actually going to take you to a one-page report. So a one-page overview telling you if you can defer or if you should enroll in Medicare and exactly why. So that's just a short form version of that webpage, not as many details, but easily printable. So many people think that Medicare is an automatic enrollment once you turn 65. And that did used to be true, but not any longer. So Medicare is automatic if you're collecting Social Security income prior to your 65th birthday. So if you're on Social Security income already before you turn 65, what's going to happen is about 3 months before your 65th birthday, you're going to receive your Medicare card in the mail. And it's going to have you enrolled in both Medicare Parts A and B. But remember, the Part B is what you pay for. And you may find after a conversation that you don't need Part B because maybe you're going to stay on your group health insurance. So if you don't want the Part B at that time, you can return the card and they won't charge you for it until you enroll in it later. Now, for anybody who's not collecting Social Security income prior to their 65th birthday, enrollment is not automatic. You're not going to get a Medicare card. In fact, you are not required to tell the Social Security Administration that you're deferring Medicare. You simply just do nothing and you've deferred your Medicare by default. So your choice at that point, and what we'll talk to you about, is do you literally do nothing and not enroll in either Medicare A or B, or do you enroll in the free Medicare Part A only and just defer the Part B until you're ready to retire later? But it is a very important decision with lots of consideration because just like that mail says, there are some strict consequences if you don't enroll and you are supposed to. For example, there could be penalties on your Part B and your Part D coverage. You could have deadlines, and if you don't make those deadlines, there's only one time of year that you can enroll thereafter, which may not coincide with when your benefits end, so you could be left without coverage if you miss your deadlines. Or sometimes, for some people, once you turn 65, the coverage that you've had all along is no longer considered primary insurance for you, and if you don't enroll in Medicare at that time, you may not have full benefits anymore. So these are all important things to consider when deciding if you should do anything with Medicare on your 65th birthday. Now, you notice that I mentioned that penalties and deadlines occur if you don't have credible coverage. So I think it's important to determine what is credible coverage for Medicare deferral. So if you have a group health insurance plan through your employer or your spouse's employer, and it's based on current active employment, then you have credible coverage. So if I'm working and I have coverage through my employer, I'm the primary insured, and I'm still working at that employer, then I have credible coverage. Or if I'm working, I'm the primary insured, and my spouse has coverage through my employer, as long as I'm continuing to work and my spouse is covered under that employer, then my spouse also has credible coverage. So things that are not credible would be individual insurance like ACA or Obamacare, or possibly group insurance that's not based on current active employment. For example, if you're on COBRA, if you have a retiree plan from your employer, or if you've been offered some kind of severance package, these are not considered credible coverage because they're not based on active employment since you're no longer working at the company that's providing those benefits. So let's assume that you are planning to continue to work and you have credible coverage. So you're on your employer's group plan, or your spouse is continuing to work and you're on their employer's group plan. So you will not receive a penalty when you turn 65, and you have no immediate deadline to enroll in Medicare. You'll have 8 months to enroll in Medicare from the time either the group health coverage ends or the employment that it's based on ends, whatever comes first. Now, whether or not you need Medicare to have full coverage is kind of up in the air. So if you're on the phone today, you're getting coverage through your current work or your spouse's current work that has more than 20 employees, If I do nothing at all today, I just want to put your mind at ease that you do not need to enroll in Medicare when you turn 65. Now, you may want to take Part A only. You may want to take A and B for other reasons, but it's not a requirement for you at that point. But if you're working for a company that has under 20 employees, we may have issues. And I have in question mark there, Medicare primary, because for many insurance plans, many group health insurance plans, when you turn 65, the group health insurance plan says, hey, this company has less than 20 employees. We no longer need to pay primary. So we're going to require Medicare A and B to be in place. Now, they'll still pay secondary, so you can keep that group health insurance as secondary insurance if you want, but you'll need Medicare A and B to add to it, or else you won't have benefits for about 80% of your medical care. That would be your responsibility in that situation. So if you were to call our office and we find out that your employer has less than 20 employees, we're going to have you go back and either check with the employer or the company plan, the group health administrator themselves, and ask if you're required to have Medicare A and B as primary insurance. So let's say you don't enroll in Medicare at 65. What happens when you go to retire at 68 and you want to enroll in Medicare? Well, if you just enroll in Medicare and do nothing else, they're going to say, well, wait a second. Why didn't you enroll at 65? Here's your penalty. But that's easy to overcome because there's a one-page form that your employer fills out. It works just like a golden ticket. It gets you right in the door to Medicare. So you're going to take this form. It's called a request for employment information. You're going to take this form to your employer and you're going to have them complete it. So one thing that I want to mention here is if both you and your spouse are covered under your employer's plan, you will need two forms, one for you and one for the spouse. And then you see down at the bottom here, it simply asks the dates you were covered under the plan and the dates the employee worked for the company. So as long as the primary insured was working for the company since you've been 65 and you've been covered under that group plan, this is your golden ticket in the door to Medicare. And you'll have lots of options for applying. We'll go over those with you at the time. You can apply online, through the fax machine, or through the mail. So let's say that you don't have credible coverage. So maybe you've stopped working early and you're on an individual plan, or you took COBRA for a few months. You've been offered a retiree plan or a severance package, and now you're approaching your 65th birthday. Well, if you're on any of these types of insurance when you turn 65, you absolutely need to enroll in Medicare. You will start to accrue a penalty of 10% per year that you wait, and you're also going to have a deadline, a short window of opportunity to get enrolled. So it's important that you address this around your 65th birthday. In addition, with individual coverage, Medicare is supposed to be primary, and with retiree, COBRA, and severance coverage, many times Medicare is primary. So what we will do is we will ask you to check with the plan administrator. So enrolling at age 65 is pretty easy. You go online, you fill out a short form. It takes maybe 5 minutes. Now, the only thing I want to caution you about here is you do not get to choose your Medicare effective date. So what month you go online during that 7-month window will determine when your effective date is. And you could have up to a 3-month delay before Medicare starts. So don't assume that if you want your Medicare to start in May, that you should go online and enroll in April, because depending on where you are in your 7-month window, you may have a 1, 2, or 3-month delay before the effective date after your enrollment. So we'll tell you, what month you need to go online to try to achieve the effective date you want. Okay, so probably the biggest piece of advice that we hear from people that they get from their friends and their family is that they can defer their Part B, the part that you pay for, but you must enroll in Part A. We hear it all the time. People call in and say, well, I enrolled in Part A because my friend said I had to. That's not always true. So you can enroll in Part A at age 65 if you want to, or any time thereafter without a penalty or deadline. So as long as you qualify for Medicare Part A for free, meaning either you or your spouse has paid your Medicare taxes, then you don't have to enroll at age 65. You will not get a penalty. There is no deadline to not enrolling in Part A as long as you qualify for it for free. But most people say, hey, Medicare Part A is free. Why wouldn't I take a free benefit from the government? Even if I am going to continue on my group health insurance, why not? And typically that is our advice too. Why not? It's a free benefit. It'll sit behind your group health plan, and it's only for inpatient hospital care. So it probably won't provide you a lot of benefits unless you have a high deductible plan or a large out-of-pocket expense when you go to the hospital. But so what? It's free. And also, it gets you established with the Medicare system. You'll get assigned your Medicare number. So when you go to apply for Part B later, the process is that much faster because you already have your Medicare number. So many times we do recommend that you enroll in Part A, even if you're going to keep working, even though you don't have to, just because it makes everything a little bit easier later. But there is one important consideration, and that's if you have a health savings account. So if you're currently on a high deductible health insurance plan and you are contributing funds into a tax-free health savings account, you cannot enroll in Part A and continue to contribute those funds to the account. So no longer will you be able to make deposits into your health savings account once you enroll in Medicare Part A. Now, don't worry, if you've accumulated a savings in your health savings account, you can continue to use the funds after you're in Medicare. You just can't put more funds in there tax-free once you're in Medicare. For those of you that have a high deductible health plan with a health savings account, we recommend that you do not enroll in Medicare Part A or B when you turn 65 if you want to continue making deposits. And we also recommend that you give us a call about 6 months before you are planning to retire or enroll in Medicare, or even let's talk through it when you turn 65 so you know what to expect. Because once you do go to enroll in Medicare later, they likely will backdate your Part A, which can impact the amount of deposits you can make in that last tax year that you're enrolling in Medicare. So it's always good to talk through that. So just to summarize, are you required to enroll in Medicare A or B when you turn 65? So for most of you on the line, that answer is probably going to be no, because your primary insured is still working, you're on that company's group health insurance plan, and your company has more than 20 employees. So if that's the case, you don't need to do anything unless you want to. The next category is the maybe category. So for those of you that are covered under an employer plan, you're still working, covered under the group insurance, but your employer has less than 20 employees, that's a maybe, and we'll talk through that individually. But for all of you that fall into the right-hand column, for example, if you're not working, you have individual coverage, no coverage, retiree COBRA, or severance coverage, for those individuals, you absolutely must enroll in Medicare at age 65, or you're going to experience deadlines and penalties. So we likely just discovered that you don't need Medicare when you turn 65 because you or your spouse is continuing to work and you have that group coverage. But would there be a reason why you may want Medicare instead of your group health insurance plan? So there's a couple things to consider here. Number one would be, do I like the plan? Is it good benefits for me? Do I have access to the doctors that I want to go to? But probably most importantly would be the cost. You know, what's it costing me to be on that group health plan? The premium and what I'm paying for my health care. So we typically say, let's look at the premium that's being payroll deducted from your paycheck, as well as what your out-of-pocket expenses are when you need healthcare, your copays at the doctor, the hospital, your deductibles, your co-insurances, everything except for your prescriptions. We add up all those numbers together and we see what the total cost is. And what we can do is a break-even analysis from there to determine, is my group health insurance more cost-effective or is Medicare more cost-effective? If your employer has more than 20 employees, then you would have to be paying at least $3,600 per year on your group health plan for Medicare to make more sense. So if your group health plan costs you less than $3,600 a year or less than $300 a month on average, meaning your premium that comes out of your paycheck plus your out-of-pocket costs. So if the sicker you are and the more you're using your health care, the more likely your group health insurance may be more expensive than Medicare. But if it's less than $3,600 a year, then your group health plan is more cost effective. Stay on it. Wait till either number one, your group health expenses go up, or number two, retirement. And at that point, we'll talk about Medicare again. But if your group costs more than $3,600 a year, then Medicare may be more cost effective. So we'll do a more thorough review of Medicare, what the benefits are, what the coverages are, so you can make an informed decision as to whether or not you should drop your group health plan and go into Medicare. Now, for those groups that have less than 20 employees, that break even is a little bit lower at $2,400. So if you're covered under a plan with less than 20 employees, then we would use $2,400 as that same break even, because you're going to need Medicare A and B regardless of if you stay on that group health plan. So one thing to consider is that your dependent spouse may be more expensive to stay on your group health plan than you as the employee. So when doing a cost analysis, what we'll typically ask you for is, what is the premium out of your paycheck for you and your spouse together? And then what is the premium out of your paycheck if you were to reduce it to single only coverage? And that difference between the premiums is in effect your spouse's premium. And many times we're finding that the spouse's premium is much higher than the employee themselves, making Medicare more attractive for probably, I would say about 60% of the spouses we work with, they find Medicare more attractive than the group health plan. Be mindful if you have a spouse that's under age 65 that's a dependent on your plan, because if you as the employee come off of the group health plan, your spouse is not eligible for Medicare yet, so their only option would be COBRA or an individual health insurance plan, which may not be very cost effective. So those are other things that we can talk through with you. All right, so let's take a deep breath. We got through all the enrollment stuff about Medicare and deadlines and penalties and all of that. Let's talk about the benefits and what the secondary insurance options are. So what you see on your screen here is what the expenses are if you had Medicare A and B only. Now, we would never suggest that you only do Medicare A and B. We would always suggest that you add some kind of secondary insurance to it. So this likely will not be your out-of-pocket, but it's important to know how Medicare treats it. So if Medicare Part A, again, is your inpatient hospital coverage. If you go into a hospital, you will pay $1,484 per hospital stay. Now, under the Part B, this is the outpatient stuff. This is where most of your services are going to fall. You have a pretty reasonable deductible. $203 per calendar year is the deductible. And for most of you, this is probably better than your current health insurance plan. But after the deductible is satisfied, there is a 20% coinsurance on your expenses thereafter. And where the risk really lies in Medicare is the fact that there is no maximum out of pocket on that 20% cost share. So you will pay 20% of the $100 bill, but you'll also pay 20% of the $100,000 bill. So that's why it's important to have secondary insurance to put a cap on what your risk is. In addition to that, believe it or not, doctors can actually accept Medicare as your insurance, and about 98% of doctors nationwide accept Medicare. So they can accept Medicare as your insurance, but they can charge more than the Medicare allowable rate for their services. In fact, they can charge up to 15% over and above the Medicare allowable rate. And there's no cap on this. So 15% of whatever the Medicare rate is, they can add to that. And of course, Medicare is not going to pay for it because it's above their cap. So this would go back to you if you didn't have secondary insurance that covered excess charges. So there's two types of secondary insurance. There's Medicare Advantage, which is technically known as Medicare Part C, or you'll have the option to choose Medicare Supplement, which is otherwise known as Medigap insurance. So what I first want to do is start talking about the Medicare Supplement plans, and then we'll talk about Medicare Advantage and how they differ. Now, Medicare Supplement plans, they are designed to be secondary to your Medicare A and B and pay the deductibles, copays, and coinsurances of Medicare. So what you see here is a few plans along the top, plans A through N. There's about 10 different benefit designs to choose from. You may have noticed that I circled Plan F and Plan G. They are the two most comprehensive supplemental plans available. And they are the only two plans that cover Part B excess charges. So if your doctor charges more than the Medicare allowable rate, no worries with Plan F or Plan G. 100% of that will be paid for by your supplement. And if you look at the column of Plan F, you'll notice that it says 100% pretty much the whole way down. And what that means is it will pay 100% of all Medicare deductibles, copays, and coinsurances. So all of those costs that we saw on the previous slide, all of these costs right here, they are all covered by Plan F. So when you have Plan F along with Medicare, you have 100% coverage of all Medicare eligible services. No deductibles, no copays, no coinsurance. You pay nothing at the doctor, the hospital, lab work, x-rays, doesn't matter, you don't pay for it. Now, Plan G is the next step down. Plan G will pay 100% of almost everything. But what you're going to notice is that there's one hole. It's right here. It's the Part B deductible. Medicare Supplement Plan G does not pay your Part B, your outpatient deductible, which is currently $203 per year. So if you have Plan G along with Medicare, you pay the first $203 of your medical care each calendar year. After that, you pay nothing at the doctor, hospital, labs, x-rays, doesn't matter. So both very good, low out-of-pocket plans. But one thing that you may need to be mindful of is that some of these plans are no longer available to new people entering into the Medicare system. So Plan F in particular is only available if you turn 65 prior to January 1st, 2020. If you turn 65 after January 1st, 2020, your most comprehensive plan selection is going to be a Plan G. And I'm going to talk about that in just another moment. So before I move on to the next slide and talk about Plan G versus Plan F, I did want to mention that there are two lower cost plans that we also recommend depending on your circumstance and what you're looking to do. If you're looking to take on a little bit more financial responsibility in your healthcare needs and want a lower premium, then we would look to something called a Plan N or a Plan High Deductible G, which would have higher out-of-pocket expenses, but they would certainly keep your premiums down. So let's talk more about that Plan F versus Plan G. You may be thinking, oh, bummer, I can't get Plan F because my birthday, my 65th birthday is after January 1st, 2020. Well, it's probably not something that you have to get too worried about. What we find in many situations is that Plan F, what I have up here are some sample monthly premiums. Plan F generally costs about $300 more per year in premium than Plan G. So Plan G will save you about $300 a year in premium. But Plan G has a $200 or a $203 out-of-pocket risk. So when you take the difference of that, you're saving about $100 a year by going with Plan G over Plan F because you're saving more in premium than you're paying in out-of-pocket expenses. So if you can't get Plan F, I wouldn't be too concerned about it. If you did turn 65 prior to January 1st, 2020, I do recommend that we at least, if you're looking for a very comprehensive plan, at least look at Plan F because sometimes it can be a little bit closer in price. And some people say, hey, you know, the difference is so minimal. I just want the 100% coverage and not have to think about anything ever. So that's certainly a personal choice as well. But I did want anybody to know who turned 65 after January 1st that you're not missing out too much on not being able to get that Plan F. So let's talk about shopping the Medicare Supplement plans. When we shop for Medicare Supplement plans, it's very easy to do because the benefits are the same with any company that you go with. So if you have a Plan G or you're looking at a Plan G, it's going to have the same benefits with United Healthcare as it does with Humana or Aetna or Cigna or some company you've never heard of before like American Retirement Life or something along those lines. So you don't have to worry about benefit differences. You also don't have to worry about network differences because with Medicare Supplement plans, there actually are no defined doctor networks. You can go to any doctor that works with Medicare nationwide. And about 98% of doctors nationwide accept Medicare. So you should not have any problem being able to either continuing to use your existing doctors for the most part or finding new doctors. The claims paying process is also the same with all of the Medicare Supplement plans. What happens is the claims first go to Medicare to determine if they're eligible expenses. Medicare pays their portion, and then they tell the insurance company what to do on the balance. And the insurance company is just required to pay that. So you're not going to find that one company pays claims that another company does not pay. And it's the same coverage anywhere in the United States. So if you like to travel or you have vacation properties or children that live in different states, you don't have to worry about your benefits being different anywhere you go in the United States. So when we're shopping for these plans, primarily what we're doing is we're comparing the premiums, who's going to give us the best premium for the benefit design that we want. And that's something that we can help you with. I know you probably can't read what's on the screen, but this is just a screenshot of what we get as an output from our quoting software. So rather than making you call every insurance company and asking what their rates are and then getting stuck on the phone for an hour with each salesperson from every company, you can just give us a call, and in about 15 seconds with your age, your gender, and your zip code, we hit compute, and we can send you a spreadsheet of the prices from about 35, 40 different insurance companies. So you can see what they are and make an educated decision on what might work best for you. So now that we've talked about Medicare Supplement, let's talk about Medicare Advantage and how that differs from Medicare Supplement. So when you have a Medicare Supplement plan, it sits on top of your Medicare and works with your Medicare A and B to provide you full coverage. When you have a Medicare Advantage plan, this plan actually takes the place of your Medicare A and B. Now, don't be misled. You still have to enroll in Medicare A and B to get a Medicare Advantage plan. You have to pay that Medicare Part B premium to the federal government in order to have a Medicare Advantage plan. You will not get away from having to pay a Medicare Part B premium. What's going to happen is this plan is going to be one ID card, and it's going to all be together, and that's going to be your plan moving forward. You'll put your Medicare card away in a file cabinet in a safe place, and you'll pull it out later if you decide ever to go back to the Medicare Supplement side of things. But while you're in Medicare Advantage, you're just going to use the Medicare Advantage card. Now, there's three main differences between Supplement and Advantage. The first one is in how you access your care. Medicare Advantage plans are managed care plans, meaning you, your doctor, and the insurance company are involved in your medical decisions. The insurance company will be involved to make sure they're medically necessary. There could be some prior authorizations involved there as well. Medicare Supplement plans are not managed care. You and your doctor are making those medical decisions. Medicare Advantage plans are network-based plans. So when I was talking about Medicare Supplements, I said you could use any doctor that accepts Medicare nationwide. So when you have a Medicare Supplement plan, your question to your doctor is not, Doc, do you accept my Aetna Medicare Supplement plan? It's just, Doc, do you accept my Medicare? And as long as the doctor accepts Medicare, they will accept any Medicare Supplement plan out there. Versus the Medicare Advantage, those are network-based plans. So if you have an Aetna Medicare Advantage plan, you would want to call your doctor and confirm that they participate with the Aetna Medicare program, not just that they participate with Medicare. So these are going to be things like PPOs and HMOs, and depending on what you choose, you may have more or less restrictions on in and out of network benefits. HMOs, you're going to definitely want to stay in network with all of your doctors. So whatever insurance company, we will need to ask if your doctors work with those insurance companies. The PPO plans, you're definitely going to want to try to stay within the network to get the best prices, but you still have some out-of-network benefits if you need them. They would just be much higher cost for you to go out of network. As I mentioned before with the Medicare Supplement plans, there are no networks involved, so you can go to any doctor nationwide that accepts Medicare. Now, the second difference between Medicare Supplement and Advantage is in the cost. Medicare Supplements have higher premiums with lower out-of-pocket expenses. Medicare Advantage has lower premiums with higher out-of-pocket expenses. So just to give you an example of that, as we looked at previously, a Medicare Supplement plan's probably going to range from $100 to $250 a month, but probably somewhere in the mid to high 100 range. And you'll have to buy a separate prescription plan. And if you want dental vision, you would buy that separate. So everything's kind of a la carte and the premiums add up. But you can pick what's most appropriate for your supplement, your prescription plan, and your dental vision to make sure you have the overall most comprehensive coverage for your objectives. But it will cost you more because it's a la carte. On the Advantage side, everything's included. You have your prescription plan and your medical included into one plan. You might get some limited dental and vision benefits in there as well. We would want to talk about that individually because although they advertise dental and vision, some of those benefits are very limited. And in addition to that, the premiums are very low. In fact, you may have noticed if you've ever seen Medicare Advantage commercials that there's many plans out there for as little as $0 premium per month. So there's definitely a lot of premium savings that could be had with Medicare Advantage. In addition, being all-inclusive and including some of those bells and whistles that people like to see, like dental and vision. Now, let's talk about the medical side. On the flip side of that, when you have a supplement plan, you're going to pay little to nothing for your medical expenses. For example, if you have that Plan G, your maximum out of pocket is $203 per year. Versus an Advantage plan, you're going to pay copays for every service. You're going to get a menu of services, and each one's going to have an associated cost. For example, doctor visits may be $5, specialists may be $40, MRIs may be $200, surgery may be $300, hospital stay may be $200 a day. You know, they all have some kind of fee structure to them. And you're going to pay these associated fees every time you need medical care. So if you don't need a lot of medical care, you save a lot of money. If you do need a lot of medical care, you don't max out your medical fees until you've paid out $7,550 in a calendar year. So max out of pocket on the Med Sup is $203 a year. Max out of pocket on a Medicare Advantage is $7,550 per year. Now, your biggest expense under a Medicare Advantage plan is going to be probably chemotherapy. Chemotherapy is covered at 20% coinsurance on a Medicare Advantage plan, at least every plan I've ever seen. So if you get diagnosed with cancer and require chemotherapy treatment, you will likely hit your $7,550 maximum in that year. And if it transfers over to another calendar year, then you'll probably hit it both years that you're receiving treatment. Versus chemotherapy under a Med Sup plan, if you have that Plan G, after $203, it's covered at 100%. So what a lot of people say is, okay, well, I'm healthy now. Why don't I go with the inexpensive Medicare Advantage plan? Because I don't really use a lot of medical care, so I'm not worried about the high out-of-pocket expenses, and I'm not really worried about the networks because I'm not using the care very much. I'll worry about that kind of stuff when I start getting sick, and maybe at that point I'll move over to a supplement plan. Well, the third main difference is in when and how you can apply without medical questions. So initially, when you first go into Medicare, you can get any plan you want with no medical questions being asked. But after you've been in Medicare for 6 months, if you ever want to go into a supplement again, you will need to answer medical questions. Versus a Medicare Advantage, you get once a year annual enrollment period to get an Advantage plan with no medical questions. So Medicare Advantage, it's easy to go from Medicare Supplement to Medicare Advantage because every year between October 15th and December 7th, you can do that. But it's not as easy to go back to the Medicare Supplement plan because once you've been enrolled in Medicare longer than 6 months, if you want to get a Medicare Supplement plan, they will ask you medical questions. And if you're not healthy, if you had anything significant happen to you in the recent past, you may not be able to get into a Medicare Supplement plan at that time. So we're also here to help you shop Medicare Advantage. We have seen them become more and more popular over the past couple years. They're becoming more comprehensive in all of the different services that they offer. So we are talking about them a lot. Now, they're a little bit more difficult to shop for because everything about them is different. The benefits are different. The networks are different. How they handle claims is different. It varies across the United States, so we always need to look and see what regions you travel to make sure you're going to have coverage in those different regions. So typically what we'll do is we'll start by asking you for a list of your doctors and hospitals that you definitely want to make sure you have access to. We'll look them up, see what plans they accept, and then from there we'll discuss the benefits of those plans. Okay, so we finally got to the last piece of Medicare, which is the drug plan, the Part D of Medicare. These plans are going to work very similarly, regardless of if you buy them on your own, meaning you went with a Medicare Supplement and got a prescription drug plan, or if you have them included in a Medicare Advantage plan. There's about 20 to 30 different drug plans available in each state, some states even more than that. All of the plans cover different medications. And the medications that they cover, they can rank them in different tiers. Every company is going to have a 5-tier structure. So every script is going to be either ranked 1, 2, 3, 4, or 5. The higher the number ranking of the script, the higher the copay is going to be. So when we shop for these plans, the best thing to do is get a detailed list of your medications, the dosage, the frequency that you take them, the name of the pharmacy that you like to shop at, and we plug all of this information into Medicare's website. And it's going to pull up the different plans that are available to you, and it's going to rank them in order from most cost-effective to least cost-effective. It's going to take into consideration the premium that you pay for the plan and the copays that you will get on that plan on your specific drugs that you're taking. And the good news is you may be thinking, okay, well, that's fine now because I know what I'm taking now, but what if I start taking something new? Well, they all do cover hundreds of medications, and they are required to cover medications in every medication category. So you should always be able to find something, but each and every year we can also reshop for you. So if you give us a call each year between October 15th and December 7th, we can go back in, edit your prescription usage list, and pull up the report again and let you know if you should stick with your same plan for the upcoming year or if you should change. And of course, if you should change, we'll handle all of that paperwork for you. Okay, so I don't want to spend too much time on this slide because it gets quite complicated, and it's always better to talk about this when we are doing a one-on-one rather than in a group environment. But what I wanted to let you know is Medicare prescription drug plans are probably the most confusing part of Medicare, and it does become confusing throughout the year. If you have expensive prescriptions, as you go to fill them throughout the year, it may get confusing at the pharmacy because you may pay different amounts for those meds depending on where you are in your stages throughout the year. Every Medicare prescription plan is going to follow 4 stages of coverage. First, in the beginning of the year or when you first enroll, you're going to start in your deductible stage. And deductibles in 2021 can be up to $445, meaning you pay the full cost of your medication until you reach that deductible amount. During this time, different plans are different. So some plans have a $0 deductible. Some plans waive the deductible on the low-cost generic meds. Some plans have a deductible for everything, so it's really just going to depend, and we'll look into that when we plug in your meds to let you know what might work best for you. Once you've satisfied that $445 deductible, you're going to go into stage 2, and here you're going to pay copays. You're either going to pay a flat dollar copay. It's year 1 might be $0 or $3. It's year 2 might be $5 or $8 a month. Tiers 3, 4, and 5 are going to get more expensive, maybe $40, $60, $90 a month, or even a percentage of the cost, like 27% of the cost of the med. And what's going to happen is every time you fill a prescription, it's going to continue adding up that prescription cost. See here, I have total cost of medication. So when you fill your script, if the script costs $100, but you're only paying $15 for it, the $100 is what they're adding up. And when all of your scripts, the total cost of the scripts that you filled for the year is higher than $4,130, you're going to go to stage 3. Stage 3 is called your coverage gap, otherwise known as a donut hole, if you've heard that term. When you're in your coverage gap, you will pay 25% of the cost of all of your medications. It does not matter if you're in a standalone prescription plan, if you're in a prescription plan that's included in your Medicare Advantage. Every Medicare prescription program has this coverage gap involved where you pay 25% of the cost of your drugs. But when your total drug cost starts to exceed $6,550, that's when you go into your 4th and final stage, which is your catastrophic stage. And from that point forward, you will pay 5% of the cost of your drugs till the end of the calendar year. January 1, you're back at stage 1 in your deductible and you do it all over again. So bottom line, if you have cheap generic medications that you're taking, they will be inexpensive in Medicare, and you're probably just going to pay a couple bucks for them. If you are taking brand names or more expensive medications, you're going to pay more for them. You may hit your coverage gap. Depending on what they are, you may never come out of your coverage gap. But if you're taking really, really expensive medications, you're going to go through your first 3 stages really quickly, and you're going to be in that 5% coinsurance for the rest of the year afterward. So, like I said, this is a hard conversation to have in a group environment. Once we know what medications you're taking, we will be able to provide you a report that shows you what your medications are, what the copays are, what months you will be in each stage, and what the costs will be as you travel through the stages of coverage. So last thing to mention about drug plans is that just like with the Medicare Part B, if you pay more for your Medicare Part B because of your higher income, you will pay more for your drug plan because of your higher income. So in the base income bracket, you just pay the Medicare prescription plan premium, which can be as low as $7.30 a month, and it goes up from there. The average premium is about $30 a month, but I'll tell you, we probably have, I don't know, maybe 70% of our clients on a plan that costs less than $30 a month, maybe even a higher percentage than that. But if you're in a higher income bracket, you can see that the federal government tacks on a surcharge each month to that prescription drug plan premium. So let's summarize this and wrap everything up. I thank you for your patience and sticking with me through this so far. Let's look at overall budgeting, what you need to know going into retirement healthcare. So here's a summary sheet that we will provide you with after a call that will be filled in with your specific plan information. This is an example that we did for somebody not too long ago. You can see the Medicare Part A is coming in at $0. Medicare Part B, if you're in the base income bracket, is going to be $148.50 per month. This is for a Medicare Supplement Plan G, so a $203 maximum out of pocket. Average premium about $135. Prescription drug plan. This is a very popular plan that we sell a lot of. WellCare at $16.20. So at the end of the day, a person in a base income bracket with a comprehensive Plan G supplement and a prescription drug plan is going to pay somewhere in the ballpark of about $300 a month, $275 to $325, depending on your geographic area, because your Medicare supplement premiums will be cheaper in rural areas than they are in metropolitan areas. For each income bracket that you go up, you can estimate by adding about $100 per income bracket. So if I was going to take you to the top income bracket here, you'll see this is for individuals earning over $500,000 or households earning over $750,000. You can see here that the Medicare supplement premium and the prescription plan don't change, but now what's changed is you have a higher Medicare Part B, you have that income surcharge on the drug plan. So individuals in the highest income bracket are going to pay about $700 to $750 per month per person to be in Medicare. So that's all I have for you today. I hope you got a lot out of this presentation. If you need any help, have any questions, want our assistance, or to set up a consultation, just give us a call at the number on the screen. I've also put up the email address, medicare@htafinancial.com. You can email us. We can send you an online scheduling link if you'd rather schedule online. What'll happen is we'll do a short intake process where we ask just some, basic information from you so we can set a phone appointment. And we'll set a phone appointment for a date and time that's convenient to you. I wanted to take this opportunity again to thank you for your time. I appreciate you spending the time with me today.